everyone to our forum, The Mental Health Epidemic Within the Pandemic. This event today is hosted by Monty J West and co-hosted by Monty J New England. We believe that it is through collaboration that the East Asian community here in Silicon Valley can become stronger. Our guest speaker today is Marc Cloutier, CEO and Corporate Officer at Caminar. And for those of you who don't know me, I'm Marilyn Tan, a physician and a Monty J West board member. Next slide, please. Next slide, please. A couple of Zoom reminders as we get started. First, this event is being recorded. Please use the Q&A function in Zoom. Questions will be saved for the end, and attendees can upvote using the thumbs up function. Please use the chat function for general conversations between attendees. Panelists will not be responding to direct chats at this time. You can raise your hand for moderator support, and you can toggle to gallery view for the best experience. Next slide, please. First off, I would like to introduce Monty J West for those of you who are not familiar with our organization. Monty J was founded in 1989 by immigrants from Asia. They bonded together to support one another because they were under-networked and under-resourced. Through this community, billions of dollars of enterprise value was created and hundreds of companies were formed. Even to this day, Monty J is focused on building community, and we do this under 3 pillars. Number 1, the first pillar, our interview series, which is focused on celebrating notable community leaders through understanding their personal journey and how they overcame some of the many challenges they faced. This focus on the journey helps us better connect great people to the next generation of leaders. The second pillar is focused on technology forums in which we bring our community new ideas to understand. This enables Monty J members to discover new opportunities for investments or career. Recently, we have held talks on venture investing, AI, and biosciences, just to name a few. The last but most important pillar is our mentorship program. This volunteer-run program focuses on helping build the skill sets needed for our future leaders. Eastern Asians are underrepresented in the leadership of many Bay Area technology companies. Today, Asians continue to lag behind their peers in being promoted. White males are promoted at 2 times the rate of Asian males, while white females are promoted at 3 times the rate of Asian females. This disparity has gotten worse over the last 2 decades, and our mentorship program strives to help address this inequality. The 6-month-long mentorship program focuses on education and deep engagement with small mentor families to help address some of the challenges of moving up the corporate ladder. We have just started open houses for this year's program, and if you're interested or know someone who might be interested, please visit the website for more details. Many mentees find this program to be an eye-opening experience to better understand how great leaders acted and thought. Next slide, please. At this time, I would like to thank our virtual series sponsors and our annual sponsors. It is only with their support that we can continue to create great programs such as this to support our community. If you are also interested in sponsoring Monty J, please feel free to contact us through the website as well. Next slide, please. Before we get started, I would also like to introduce Caminar as an organization. Driven by compassion, science, and an understanding of root causes, Caminar delivers high-quality prevention, treatment, and recovery services to those with complex mental health, substance abuse, and co-occurring needs. Founded over 50 years ago, Caminar is a nonprofit, community-based agency that served more than 18,000 people last year in the San Francisco Bay Area and Northern California. Next slide, please. And now I'd like to introduce our guest speaker, Marc Cloutier, MPP, MPH, CEO and Corporate Officer at Caminar. Marc became the CEO and Corporate Officer of Caminar on January 31st, 2019. Marc has dedicated his career to increasing access to quality health and supportive services for underserved communities and improving the overall health and well-being of individuals and families. Prior to joining Caminar, Marc held leadership roles in major health organizations and foundations, including Horizon Services, the San Francisco Foundation, the Center for Youth Wellness, Kaiser Family Foundation, and San Francisco AIDS Foundation. A long-standing Bay Area resident, Marc is a graduate of Lewis and Clark College and earned his Master's of Public Policy and Master's of Public Health degrees from the University of California at Berkeley. He has authored a number of articles and recently co-authored Prevent, Screen, Heal, collective action to fight the toxic effects of early life adversity. Mark also serves on the board of directors of the Tenderloin Neighborhood Development Corporation. For those of you who don't know me again, I'm Marilyn Tan. I'm the chief of the endocrinology clinic at Stanford Healthcare and a clinical associate professor of medicine at Stanford University School of Medicine. I am also a Monty J West board member. Next slide, please. This is an outline of what we will review today. First off, we will go over the background on COVID-19 and mental health, and then talk about the presentation and long-term effects of mental health disorders. We will also touch on the biology of mental health and conclude with mental health and Asian culture. And then we'll save all of the questions for the end. Disclaimer, neither Mark nor I are mental health professionals, so this session is in no way intended to serve as a replacement for appropriate diagnosis and clinical care from a mental health care professional. If you or someone you know is exhibiting worrisome symptoms, please don't wait, seek care immediately. The goal of today's discussion is to increase awareness and knowledge about the mental health epidemic. We hope that today's session can be informative and get people thinking more about the mental health epidemic during this pandemic. A little bit of background, COVID-19 has certainly disrupted our lives and relationships. The pandemic has caused increased stress for people of all ages. COVID-19 has changed how healthcare, especially mental health, is rendered. Some positives that have come out of this pandemic include different modes of access to mental health care, which is new. Previously, challenges to mental health care included difficulty with scheduling, people not wanting to be seen entering mental health providers' clinics, traffic and parking, disruptions to work and school. But with telehealth, access to mental health care has actually become simpler for a lot of our patients. On the other hand, there are still persistent barriers to mental health care, including reliable access to technology, costs, and cultural barriers, which we will talk about today. With that, I'll start with my first question for Mark. Mark, on a broad scale, how have you seen COVID-19 impact mental health? How common is it to experience challenges with mental health?
Thanks for the question, Marilyn, and thank you for inviting me to speak. And I also want to take a moment to acknowledge Si Ping, who's our board member and a member of Monty J West, who was the conduit and the invitation to speaking to you. It's a great pleasure to be with you all, and I'm particularly happy that there's an interest in this topic. COVID-19 has affected, as Marilyn talked about, has affected the health of the population in many different ways, obviously causing people to have symptoms associated with COVID-19, and obviously it's had a substantial effect on mortality rates. There are over 270,000 Americans who've died of COVID, and in part because of the public health strategies that included isolation, lockdowns, people not attending school, people not attending work, family members being isolated, care facilities being shut down. It has led to a wave of mental health and substance use symptoms that for the majority of people will pass with time and some treatment. And for a small number of people, some of these symptoms may endure or actually worsen. So if we could jump to the slides for a minute. Talked about this. So yeah, obviously the health effects have led to illness and loss of employment. There's been death. This has all been well described in the media. Less understood are the mental health effects. So we want to explore what this looks like, how it affects different age groups differently, what the symptoms look like, and then to connect with one of the comments that Marilyn made in her introduction, we're going to talk at the end about what are serious symptoms that you would recommend someone seeking professional care for. Next slide. The more common ones have arisen from isolation and containment have been anxiety. People who are experiencing fear, it can be mild to actual panic disorder anxiety that can actually get in the way of functioning in your life. Many people have experienced depression, which can show up as a kind of hopelessness, ranging from a kind of hopelessness lack of energy, change in eating, change in sleeping, withdrawal. A lot of people either have initiated use of alcohol or drugs, or people have had long-standing drug or alcohol addictions. Some of those people have returned to use, and they're using in ways that are harmful to themselves. And one focus that is, I think, less described in both the survey data and some of the epidemiological data is the effect that this is having on young adults. And we'll drill down deeper into that when we get into some of the survey results. But I say this in part because I have young adults in my life, and I frequently hear from them about them and their friends about this kind of dangerous combination about climate change and the hopelessness that that's led people to, combine to COVID-19 challenges around completing college, starting their careers, that is really, I am most worried about in terms of young adults. Next slide, please. So I've kind of described this, and I want to talk more about these symptoms show up differently for different age cohorts or different developmental cohorts. So let's go forward to that. Well, okay, so let's talk about the immediate effects. This is probably the most concrete measurement of the share of adults reporting symptoms of anxiety disorder or depressive disorder. So when we use the term disorder, we're not just talking about someone feeling anxious. We're talking about someone who's risen to the clinical level of actually having a formal mental health diagnosis. And if you look at this, this basically says the difference between 2019, which was before the pandemic, and January 2021, a few months back, is a four times the number of people who had anxiety and depressive disorder are now displaying symptoms and or seeking care for those two important conditions as a result of COVID-19. Next slide, please. It's falling differentially about how people are describing the negative impact on their mental health. It is increased, it's highest among young adults and mothers and women and people with medium income, people with chronic conditions, and then African Americans and Caucasian Americans. And then as you go further up the age scale, the effects are less onerous, which we'll unpack in a little bit why that might be the case. Next slide, please. This is just a version of what I was saying before. There's a differential between women and men. There's a differential particularly around young women and middle-aged women. Some notions about that are the effects that women may be experiencing about the impact of this on their children, the impact of it on women early in their career, the impact on women who are taking care of two generations, both their children and their family and their parents. And those are some of the explanations about why we see this differential between women and men. Next slide, please. And then interestingly, it will perhaps come back to this. I think what's interesting for this group is the reporting of symptoms by ethnicity or race, in which non-Hispanic Asian Americans are below average for all adults. So I want to just put forward as part of a discussion item, is there something in Asian American culture that creates some sort of resilience or support or buffer? This would suggest that there's some buffering effect going on in families or communities against these symptoms of anxiety or depression. Next slide, please. So again, this breaks it down. This just reinforces that there's a differential by age, and it's quite substantial. The rate of depressive anxiety disorders among young adults is almost twice that of older adults. So again, I would put forward that aging, that being older, having had more life experience, having faced more adversity, having developed more coping skills, has been somewhat protective against mental health disorders in the face of COVID-19. Next slide, please. This is also very interesting. This suggests, I would describe this as a dose response, meaning that people who are actually having to work, being in settings where they're potentially more exposed to infection. So this is comparing essential workers, people have had to go back to work, grocery workers, transportation workers, healthcare workers. My staff providing mental health services fit in this category of essential workers versus non-essential workers, people who are essentially able to continue doing their work from home. That there's a substantial differential, as you can see, between those who are experiencing depressive or anxiety disorders, those who started using substance use as a way of coping, and those who considered suicide, which I think is obviously the most worrisome statistic there, that the percentage of people considering suicide was 3 times what it was between essential workers and non-essential workers, which means that the level of coping far exceeded the kind of fear exposure that people were having on a regular basis as a result of being out in the workplace where they were exposed to other people who could infect them. Very serious statistic here. I think of all of the statistics that I've presented to you is the most worrisome. Next slide, please. Okay, then I'll pause and hand the mic back to Marilyn for some more questions.
Yeah, thank you for those statistics. 22% considering suicide, that is alarming. 1 in 5 people, so that is very eye-opening and very jarring. So thank you for that introduction, Mark. We know that COVID-19 affects people differently, and you had talked a little bit about this. Perhaps one way that we can stratify groups is by age. So can you walk us through the presentation and symptoms for mental health disorders going by age, perhaps starting with children?
Sure. Let's go to the next slide, please. So, you know, I want to talk about children briefly and acknowledge that for most kids, the symptoms that we're going to talk about will pass as the containment changes, and their parents who are experiencing their own symptoms, which we'll get to later. One of the challenges for children, one of the things that we've learned from adverse events research in children, that children can experience adversity, and the effect on it having either a long-term pathological effect or being a transient emotional effect, is the ability of a parent or another adult who can self-regulate themselves and essentially buffer the child's exposure by normalizing, reassuring, providing emotional and physical contact and support to the child. So the effect that a child is going to have from the COVID-19 mental health challenges is going to be mostly affected by their proximity to an adult who can buffer the effects on them. So some of the things that we're concerned about may be some developmental effects. You know, in general, there's this conversation about children have lost a year. Many children have been homeschooled. Some kids have had hybrid. A very small number of kids have remained in school. So, you know, there's been some version of a year of learning. And, you know, we think of learning as the traditional skills around language, math, science. But there's also important social emotional learning that happens in the school setting that children have foregone, about playing with others, going through the structure of a day, interacting with an adult in the way in which that they do with teacher aides or teachers. And that hasn't occurred this year. And some kids are going to need a little bit of catch up. You know, Governor Newsom is talking already about a longer school day or a longer school year. So there's going to need to be some catch up. The other thing that's happened is that, one of the things that happens in school, obviously, is physical education and playing, and kids have been isolated at home. Many parents have been apprehensive about bringing kids to playgrounds. So kids have also had less movement and less mobility, and that may affect their physical development in some ways, that they've lost the ability to develop some fine motor skills, perhaps catching, throwing, a bunch of things that are really important, not just for their physical development, but for the relationship between cognitive and emotional development and physical development. And then there's this notion that losing parents having fear about their elder parents taking care of their parents talking about, we don't want to go see grandpa because we don't want to expose grandpa to getting potentially infected, and or the actual death of family members, that it's possible that children have interjected the fear that their parents are feeling into their own emotional life and may carry that forward. So some big concerns about kids that we want to be mindful of going forward. Adolescence, it's a little different. I think, if we think about adolescence and kind of oversimplify it, the task of adolescence is to separate your identity from how your parents have thought of you as a child. And, rebellion can be part of that, becoming your own separate person, thinking about yourself, talking about yourself, relating to your peers, your siblings, and your parents with a new identity is very important. And very important in that is actually getting away from your parents, is being outside of their sphere of influence. And we know that's been challenged by isolation and quarantine and lockdown, that a lot of adolescents, instead of spending time with their peers, in activities, in school activities, theater, sports, hanging out with their friends at the mall, hanging out with their friends at playgrounds. They've had to spend time at home with their parents and substituted a lot of time with peers by being on screens. And, we know that a lot of screen time is not ideal. And we know that a lot of screen time, in particular for adolescent girls, can actually be very harmful. We know that there's a lot of relationship between screen time and depression, between screen time and self-harm, screen time and suicidal ideation. So this has been a really, really hard time for adolescents. And in addition, they've lacked the possible lack of physical movement and activity. So they've lost some time about development of, again, fine motor skills that are really important, again, not just for physical development, but the relationship between fine motor skills and intellectual and developmental progress. Next age group, please. Then there's young adults, and I mentioned this earlier. It is frankly my primary concern as running a mental health organization, is that we have a group of young people who, before the epidemic, had a lot of anxiety about what kind of future world they were going to live in, whether or not kids openly talking about not wanting to have children because of climate change. And now this ambiguous future that's made even more worrisome. It's not just that COVID, let's say we get herd immunity. Let's say that in 2 years we get even better vaccines that eliminate the fear of of exposure to COVID-19. Kids now know that they're likely to face a lifetime of exposure to breakthrough infectious diseases that could dramatically affect their life. The innocence that many of us, I was born in 1957. We have grown up, the adults on this call, with the exception of HIV, we've grown up in a time in which our lives were relatively free of mortality because of infectious disease. And young adults have not had that experience. And they now know that over the full course of their lifetime, that some other life-threatening infectious disease could occur. Kids are also young adults are facing a loss of opportunities for starting careers and employment, in part because, as we know, employment contracted. The good news is we're starting to see a really robust recovery already. So hopefully that will dispel some of it. And again, young adults have lost the ability to socialize in person with their peers. Middle-aged folks are experiencing slightly different stresses. There's the stress of homeschooling children and taking care of aging parents. Most parents were not prepared to actually be kind of a school aide while their children are attending school online, of assisting them with their assignments. A lot of parents were cut off from their own parents to avoid infecting their parents. So there's some feelings about worry, anxiety, guilt, maybe depression, worrying about the educational lag and economic effects that I've described about the effects on their children. And then the importance of taking care of others that may lead to self-neglect. I would be particularly worried about females about that occurring. And then for seniors, we know the isolation, the need of wanting to protect them. Obviously, they were at the highest risk of having either serious disease or death due to COVID-19 infection. The lack of stimulation and the effects on developing dementia or other cognitive decline. And then obviously the persistent fear of dying from COVID and the anxiety and depression that occurs from that. So these are just kind of some broad generalizations by age groups about the way in which the epidemic has created different profiles of mental health and substance use concerns.
That was very helpful, and we can see that certainly depending on the age and your stage in life, the effects can be very different. Any thoughts on some potential long-term effects among the different age groups?
Well, I do, so I want to talk about the flip side of this, which is, one of the effects on all age groups is there are people who, stayed connected to family, were able to work, volunteered, deepened their relationship with their life partner or their husband or their wife, deepened their relationship with their children, started meditation, started volunteering and delivering food to people, who've developed, we should not underestimate this, developed amazing resilience that will serve them for a lifetime. And I'll close by some of these resilience skills, but I want to emphasize and bring to everyone's attention that there has been an upside of this for many people, in addition to the death and illness, that people have prevailed, they've drawn closer to their friends and their family, and they've learned new things about themselves, about facing adversity and helping others get through it.
That's a great point, Mark. People have been able to be stronger than they ever thought during all of this, and people have become, super parents, taking care of elders and taking care of their children while working from home. I'm always amazed at how people have coped through over a year of this now. So I'm glad that you reminded us that some positives did come out of this.
Definitely.
Now, I'd like to take a pause here and, as a physician, talk a little bit about the science behind mental health. So as I said, I am not a mental health professional, but I'd like to talk about the biological basis behind some of the mental health disorders. So first off, a little bit of pathophysiology of mental health. Mental health disorders are thought to be caused by a combination of genetic and environmental factors. So in medicine and with science, with many diseases, we think about what we call a two-hit hypothesis, meaning that somebody has some kind of predisposition and then another trigger pushes them over into the disease. Some contributing factors may include genetics or inherited traits, environmental exposures, even starting from in utero or before birth, and alterations in neurotransmitters in the brain. Other risk factors for developing mental illness can include chronic medical conditions such as diabetes, acute medical illness, prior traumatic experiences, social isolation from COVID-19, stressful life situations like financial problems, other sorts of pandemic stress, loss of a loved one. And it's important to remember that mental health and physical health are inextricably linked. People can have physical symptoms from depression and anxiety. You can have real abdominal pain, fatigue, mental fogginess, weakness, or loss of appetite. Depression and mental health issues may also affect health outcomes. Emotional stress can certainly worsen health outcomes, and it can trigger certain health conditions like autoimmune disease. So one classic example, as an endocrinologist, I will say, is autoimmune thyroid disease or Graves' disease. This is an autoimmune condition in which patients may actually take medication for a period of time and taper off, also known as going into remission. However, if there is a stressful event, this can re-trigger a flare of the Graves' disease, making the autoimmune thyroid disease more active again. So again, we cannot separate out physical and mental health. Now getting back to our discussion with Mark. Discussing mental health is never easy, and especially in Asian culture, it's not something that many of us feel comfortable discussing with family members. Do you have any suggestions on how we can talk to family members about mental health and how we can destigmatize seeking care for mental health?
An important way to do it, particularly for parents with their children, is for parents to be able to talk about what they're feeling, and use that as an invitation, model that it's appropriate, it's healthy to talk about feelings, even difficult feelings like mommy's scared, and this is why mommy's scared, and this is what mommy is doing to take care of herself or to seek support. So modeling feelings, talking about ways that you can cope with those feelings are good ways of introducing and teaching children about how to understand and identify their feelings. Another important thing is to identify when you observe a child having an emotional response, to name that response so that a child starts learning the association between the sensation that's going on or the feeling that they're having in words that an adult gives to them, so that they start developing an emotional and hopefully a sophisticated emotional vocabulary, so that they can then talk more about their feelings as opposed to somatizing them or acting out around them.
What about talking to, for example, a parent? Growing up, I didn't have a lot of very personal conversations with my parents about things like emotions. And so how do you, as an adult, talk to your elderly parents about mental health when it's something that you've never talked about in your entire life?
Again, I think it's often it's inviting the conversation as opposed to pushing the conversation. And I think inviting the conversation is to talk about your own feelings, to say, I worry about you. I'm observing that you're not eating very much, or I'm mindful that mother died. This is the anniversary of mother's death coming up, and I certainly feel sad. I'm wondering what you're feeling as this time is approaching. It's really talking about authentically talking about your own feelings and creating an invitation and a space for them to walk into it, even if they don't have a vocabulary yet or they've avoided it before. It's really about inviting as opposed to pushing or trying to name or identify or diagnose.
Well, it's difficult to talk about mental health without addressing the recent increase in hate crimes in the AAPI community. The increased prevalence and awareness of these hate crimes has certainly increased stress and anxiety levels in Asian Americans. It's time to be vigilant and especially supportive of our elders in our community, but how can we remain vigilant but not let the stress overtake you?
So this is a very obviously troubling development, and I think it's important to acknowledge the climate that was created that caused this to happen, which is this is connected. We're having this conversation in part because it was connected to COVID-19, that was intentional misinformation that was promulgated by our president and by other thought leaders in our country that created a milieu in an environment where people who are racist or are motivated by hatred could tie the misinformation about the origin of the COVID-19 epidemic and essentially scapegoat a group of people. So I think it's important to say that. And I say that in a hopeful way that misinformation is occurring less. I'm not sure it's gone away completely. So the good news is hopefully the drivers of the part of the hatred and the hate crimes are diminishing in the environment. And I think it's actually a time to the vigilance, the kind of vigilance that's useful is to just be in more contact and check in with each other. And I would just acknowledge there's been a disproportionate focus on Asian American seniors in particular, who are seen probably as being more vulnerable by haters. So I think it's checking in more frequently on our parents and seniors in our community and actually asking, without trying to create too much fear, that when seniors go out, that they check in with someone before and after, or you check in with them before and after. One, to provide reassurance that there's someone watching out for them. And secondly, that they know that there's someone who's gonna, if something happens, there's gonna be someone who will know what to do. So I would just encourage a little more frequent contact with parents and with elders. In particular, asking them that when they go out, when they go shopping or they go to the doctor or something, just to like have a check-in before and after.
That's great advice. I think especially when we're not able to physically see each other, checking in with people you care about is very helpful. When should people think about getting help? Next slide, please.
Yeah, let's jump. There's a slide. Thanks for asking that question. So these are mostly, I'm going to talk about these in a minute. These are mostly this more serious presentation of symptoms that are associated with depression and anxiety, which, as I mentioned in my presentation earlier, are the most frequent manifestations of mental health symptoms. So hopelessness, and I would add a caveat to all of these bulleted symptoms that I would add a time span. And that would be when these symptoms endure for 2 weeks or longer. I doubt that there are many people who are in this conversation, who are participating in this forum right now, who haven't had a version of some of these feelings throughout the epidemic, right? I mean, I certainly had my feelings of hopelessness. My sleep did change. The impact on me was I underate. I did find myself wanting to stay at home and not talk to people or not talk about how I was feeling. I've probably had on a few nights 1 glass of wine more than I usually do. I've not had thoughts of self-harm. I have been angry. I found, like, why am I so angry in driving during this period? And withdrawal. So I'm just highlighting all of these and talking about them personally. I think most of us have felt this way over the past year and few months that we've been going through this epidemic. It's when it lasts for 2 weeks or longer that then you want to think about either contacting your primary care provider or contacting a mental health provider or community health provider and checking in about whether or not this is the time to get care, mental health care.
Thank you for sharing your own experience. And I'm sure all of us have experienced some of these many times throughout the pandemic. And I think it's very important to highlight that persistent symptoms over 2 weeks, that's a good and very helpful cutoff. And, you know, short of seeking professional help, what are some other things that we can do for ourselves to practice self-care and make sure that we do everything we can to not get to the point where we necessarily need to get professional help.
Sure. I think it's always, it's always useful to talk about these symptoms with a family member or friend who you can trust. And to ask for support from family or friends, short of the 2-week period. I would just add, there's obviously, for people who are members of faith communities, there are other sorts of supports that people can seek from their pastors or their ministers, their priests. They can often be helpful when it hasn't actually progressed to the point where it's a serious disorder.
Next slide, please.
So these are general principles that are not just for mental health, they're also for physical health. And this is a bit of an answer to Marilyn's last question. To remember to connect, to fight back against the isolation and the withdrawal by intentionally connecting to family and friends. And I think it's really important in this time to reinforce the importance of the relationship, to actually say, I'm really happy that we've had this friendship since college, and it means so much to me. And this time of being challenged and feeling frightened and knowing that you've been there as a friend has made a world of difference for me. I think this is really a time to express things like that, to express gratitude for the friendship. To reflect worrisome symptoms, to create context for people to understand their circumstance. This is going back to what I was saying. This is also a time when we should be, I would describe it as developing more sophisticated emotional intelligence about describing what we feel, normalizing that it's very normal to have difficult feelings during this time, and that may persist after the resolution of the pandemic. I think considering 20 minutes of meditation or reflection, and I'll invite Marilyn to talk about its effect on immune functioning. We know that slowing your autonomic nervous system improves immune functioning and can bolster your ability to either fight off an initial infection, or if you are ill, to actually improve your immune system's ability to fight an infectious agent. Sleeping is very important to that too. Sleeping in a cool, dark place without exposure to screens. That's really important for kids, to have them shut down their screens. It's 2 hours before going to sleep. That's the important time. Exercise for 60 minutes a day will improve your sleep, improve your reported symptoms of anxiety or depression. And lastly, eating a healthy diet that's focused on plants and lean protein, legumes. All of those will both help you deal with your emotional symptoms and also improve your immune functioning.
Yeah, just to piggyback on what Mark said, as a physician, these are things that I recommend to my patients, regardless of what health condition they see me for. Like Mark said, these practices are good for your overall health, for your circulation, for your immune system, for any health conditions you may have, particularly things like diabetes. Even we know that in, for example, cancer treatment, meditation and self-awareness and all of these can help with someone's coping and with actually how well they do in disease. And so I think these are very important practices to keep in mind for your overall health and for your mental health. Thank you so much, Mark. Is there anything else that you would like to add?
I can't think of any, and I'm looking forward to the questions. Okay. Thank you, Marilyn.
Thank you. So we hope that today's session has given everyone more insight to the current mental health epidemic. The COVID-19 pandemic has certainly posed new challenges, but like Mark pointed out, it's also brought out amazing strength and resilience and resourcefulness in people. Mental health discussions can make people uneasy and uncomfortable. So we hope that talking about this today can help open the door to some more candid and destigmatized discussions around this topic. And now we'll move on to the Q&A. So let's see.
Great. So we have one question from Susan. This is in reference to the data points and the analysis that was provided earlier on. What is the sample size of the study? And is there a geographic difference or differences? Are there geographic differences?
Good question. If we can go back to the slide, I think there's some footnotes. Those slides were all taken from 2 surveys the Kaiser Family Foundation did. I believe they were telephone surveys. I don't know if the sample size, it's adults 18 and over, was in that one. And they use telephone sampling survey. I don't know what the N was in these studies, but they were enough to get statistical significance.
Great.
Sorry, I can't answer I didn't look at the formal survey methods.
We have a second question from Parth. Has the psychology community considered updating the way therapy is delivered to better reach young adults? Parentheses, ease of access.
I'm going to give a little spoiler alert about an event that we have in a week in which we are bringing together the former head of the National Institute of Mental Health, who's also been a startup of a number of handheld and web-based approaches to delivering behavioral health for young adults. I think there's enormous opportunity that hasn't really been fully flushed out or developed since kids are spending a lot of time on handhelds and on screens, of reaching them there with both mental health treatment as well as mental health profession. So I think we're really at the front end of that. But I have a lot of hope for that. And I would just add, in our own delivery of our mental health services, we went 80% of our services have been delivered by telehealth over the course of the pandemic. So I think a lot of people who are forced to use telehealth are not going to want to go back. Actually, it's very convenient, and I think it's going to, paradoxically, the epidemic is going to drive innovation in mental health service delivery.
Great, and we just posted on the chat function, there's future events coming up at Kavanaugh.org related to those things that Mark just talked about. So please check out their website to find out some of those events. From an anonymous person, I wish to share some of these slides with a relative. Would that be possible? Mark, will we be able to make these slides public? Great.
Happy to, yeah.
Great. We have another question from, I believe this is Jorge. How to manage dual for the family, but also how to help and go beyond the impotency about helping someone in isolation.
Yeah, meaning I assume when Jorge says someone in isolation, someone who's in isolation who's refusing contact. And I don't quite know what to do about that. If someone, I think that's a time where there has to be some sort of physical presence that's brought to a situation like that. When there's refusal, I think what you can do is just invite by talking about what's going on, what you're feeling, and inviting someone when you share that with them, to share where they are. And if people refuse, that's part of their autonomy. They can refuse to engage. So I don't have an easy answer for that. It's working with people's resistance. I think, that's a classic therapeutic technique, like to understand what it is, and working with the resisting by asking, well, what you may not want this to happen, but what would you like to have happen? What is it? I know you don't want to talk about what you're really feeling now, but what is it that I can do to help you feel better? Or what can I do to help you feel more functional?
Great. We have another question from an anonymous attendee. Is there a difference in therapy efficacy between in-person versus virtual?
I don't know the studies on that. I think there probably would be, in part because, again, as Marilyn gave the disclaimer, I'm not a clinician, but we know that part of an important component is being in the room, reading facial cues, musculature, respiration, how someone's sitting, their body, how they are in their body is all important information for the therapist to be using as part of the therapeutic intervention. So I have to imagine, I don't know statistically what it is. I have to imagine there's some loss of complexity of information on the therapist's part that happens, that's just lost through telehealth.
Great, thank you for that. We have another question from Charlie. What role does technology play in substantially helping people manage mental health? Also, how can companies help employees beyond wellness programs and apps?
So I think this has been a time for employers to understand a new leadership skill of managing with compassion. I think most organizations have had to adapt to people who are working from home, create alternate kind of work schedules for people who are taking care of parents or children. Parents, we've had to do this. I've had to do this as an employer. We have staff who had children at home and actually had to spend a bulk of the workday helping their kids with school online. And to just be more compassionate about flexing benefits. We've gotten a little more assertive about encouraging people to use their employee assistance program. One of the effects, I just go back to one of the graphs that I showed about the differential between symptoms of people who are essential workers and non-essential workers. And our staff have had a lot of, this is my staff, the dark blue bars are my staff. And I'm sure many of you work in organizations or may run organizations where people had to show up. So because of this, I've encouraged people more assertively to use our mental health benefit. And, to give people more mental health days, to give people to understand that people this is difficult, and to be a more compassionate manager and to model more compassion by asking people how they are, and to be more grateful manager of thanking people for their resilience and for their ability to support each other during this time.
Great. All right, what would you, so this is a question for myself. What would you say to the next generation? So I know there might be some people with, younger kids here, or maybe they want to have a conversation with their kids. What would you say, how can they as parents kind of help? I know you talked a little bit about, addressing emotions or feelings, helping them emote a little bit. Are there any other suggestions for new parents to be?
New parents to be, so that's you.
That's right.
Well, and let us say early congratulations for a new parent to be.
Thank you. Thank you.
I think it's about creating hope, and I think it's really about creating a hopeful belief about what's going to happen in the world. I go back to this dilemma that we're seeing with young adults, and because of global climate change, and because of being exposed to a deadly infectious disease early in their adult life, and the way that this has clouded their ability to imagine a safe and healthy and thriving future for themselves. And I think, one thing is to provide reassurance, that in fact, the good news is the scientific response to this epidemic has been profound. I mean, I know many of the people probably on this call have been vaccinated. In California, everyone 16 and over can now get vaccinated. So the flip side of how challenging this has been, the fear, the anxiety, the depression, is how we've rallied, how we've united, how we've collaborated, how quickly science was used to protect people and develop therapeutics. So I think it's really talking about the ups, not diminishing, acknowledging the feelings about the fear and the loss, and the challenge that it creates about imagining a future, but really emphasizing the resilience, the success, the collaboration, what his science has produced for us. And creating a good balance between those two. Actually, I think that is really fostering emotional health, is acknowledging the fear, acknowledging the difficult impact, and then also acknowledging the what people have done to cope and what in fact we've been able to accomplish as a society to get through this.
Great, thanks, Mark. Marilyn, this wraps up the questions. Back to you.
Okay, so again, thank you all for joining us today. Particularly a special thank you to Mark and Kaminar for taking the time out of your Saturday afternoon to give us this very valuable information. And we really appreciate all of the knowledge and experience that you bring forward, and also everything that you and your organization are doing for the community. And a special thank you as well to Monty J New England for co-hosting this event. And that's it from my end. And so we'll finish up with a couple of announcements and things to share from Monty J here.
Great. Thank you, Marilyn. And thank you, Mark. Just very quickly, we always love to plug our mentorship program. Again, this is one of our key pillars. We want to thank all the sponsoring companies of our mentorship program, Klein & Perkins, NEA, WePay, JP Morgan Chase, VMware, all these great companies that bring out speakers, mentors, and leaders to join in our cause. Moving forward, we have 2 events coming up on the 24th. We have a hiring manager series supported by Teresa Fung, a former Alexa AI group manager. And then on 5/1, we have alumni chat series with Will Yun, Director of Strategic Biz Dev for ARM. For any additional updates, please go to montyj.org/mentorship. Here's some of our events from this past year, actually a little bit more than last year because we were not able to meet mostly in person last year, but we have some great events. Last year we held over 40 plus events for our community, and this year we're on track to also holding another 40 events as well, both virtually and hopefully at the end of the year in person as well. We also have other Monty J events, not just our mentorship events. On 5/15, we have an interview with the CEO of ASE, Advanced Semiconductor Engineering. He's a great leader. They run over $11 billion of revenues. And the title of that session will be The Art of Personalized Leadership. So I'm really excited about that. He's a Nana, who is actually, I believe, also on this call today, is the VP of Sales of ASE and also a board member of Monty J West, and she'll be interviewing her CEO. And then on 6/18, we will have a board-to-board interview with the former CEO of Best Buy, Herbert Jolly. And the title will be The Heart of Business, be it in hospitality, retail, or digital platforms. The interviewer will be our current chairman, Peter Shea, who is general partners of Acorn Pacific Ventures. And I'm looking forward to that event as well. So we're bringing some great speakers to our community coming down the line. And please check our website for our future events. And we're looking forward to having you there as well. Mark, would you like to talk a little bit about some events coming out at Kaminar?
Yeah, I just answered a question in chat, which was a good launch into this opportunity here. So there is, someone asked about a shortage of behavioral health providers given the demand, and we at Kaminar actually cannot recruit enough staff to meet the demand that we have. This is not just true in Kaminar, it's across mental health, that there's a mismatch between the number of people who are trained, the people who are trained with the right language and cultures. So, and then we've also talked about telehealth, the opportunities of new technology, and then there's going to be changes in reimbursement. So the whole field is about to go through a dramatic shift. And we have organized this speaker series to invite experts to come and talk about this revolutionizing behavioral health care that is upon us now. It's on April 23rd, a week from yesterday at noon. And you can find out about it by going to our website and sign up at kaminar.org.
Great, fantastic. And with that, I want to thank everyone for joining today. Thank you so much, Mark, for coming and spending your Saturday with us. Thank you, Marilyn. And thank you everyone that joined us as an audience member as well. I'm looking forward to seeing you at future events. Have a great weekend. Get out there, get some sun, and have some fun. And looking forward to seeing you guys in the future. Bye, everyone.